Have you ever heard of a disease so sneaky, so complex, that doctors call it the great imitator? Well, today we're diving deep into that very condition, systemic lupus erythematosus, or as most people know it, SLE. The Lupus Foundation of America has a motto that just sums it all up. Help us solve the cruel mystery. And you know what? That's exactly what we're going to do. We're going to play detective, follow the clues, and figure out how this disease hijacks the body and what it really takes to solve this puzzle. So here's our roadmap. We'll start with the mystery itself. Then we'll see how the immune system gets hijacked. After that, we'll look at the clues, all the different faces of lupus. Then we'll see how a diagnosis is actually made. And finally, we'll talk about managing and living with the condition. All right, let's get right into it. What exactly is this cruel mystery we're talking about? Okay, the one word you absolutely have to get is autoimmune. Think about it like this. Your immune system is your body's highly trained security team. It's supposed to hunt down bad guys like viruses and bacteria. But in lupus, the security team gets totally confused. It starts seeing your own healthy cells as the enemy and, well, it attacks, causing all sorts of inflammation and damage. That, of course, leads to the million-dollar question. How does that even happen? How does your own personal bodyguard get hijacked and turned against you? You know, that question is what's been driving researchers for decades. And while we don't have all the answers yet, we have a pretty good idea of the chain reaction that causes this autoimmune betrayal.
So it all seems to kick off with a problem in the body's cleanup crew. Normally, your body is great at clearing out old, dead cells. But in people with lupus, that cellular trash doesn't get taken out properly. It builds up, and that pile of debris basically acts like a false fire alarm. It triggers the immune system's special forces, the T cells and B cells. The B cells then go completely rogue and start pumping out these weapons called autoantibodies. But instead of fighting real invaders, they attack your own healthy tissues.
Now, this war happening inside the body doesn't just stay quiet. It produces a whole bunch of clues, what we call symptoms. And because this attack can happen anywhere, the symptoms can look like a dozen other things. That's why it earned that nickname, the Great Imitator. For a lot of people, the first clue is something you might just brush off. You know, a fever that won't go away, a fatigue that's just bone deep, or maybe losing weight without trying. But the single most common clue, and we're talking over 90% of patients here, is painful, swollen joints. That's usually where the investigation really starts. And this right here is what makes diagnosing it so tricky. The most famous sign, the one you've probably seen in pictures, is the butterfly rash across the face. It's totally iconic. But here's the kicker. It actually affects less than half of all patients. So if a doctor is only looking for that one sign, they're going to miss most people with lupus. And the skin issues can look really different too. For instance, this is what's called discoid lupus. It creates these thick, scaly, round sores. You can get them on your scalp, your face, even inside your ears. And unfortunately, they can leave behind permanent scars.
Remember, the first word in the name is systemic.
And that's for a very good reason. This isn't just a skin-deep problem. The attack can go after almost any organ system. It can cause serious kidney damage called lupus nephritis. It can hit the nervous system, causing things like seizures. It can mess with your blood or cause dangerous inflammation around your heart and lungs. It can be incredibly serious. So you have all these scattered clues. Some are vague, some are super specific, and they can show up anywhere in the body. How on earth does a doctor take that jumble of information and come up with a definite diagnosis? That is the puzzle. For a long time, diagnosing lupus was basically a checklist. If you checked 4 boxes out of 11, you had lupus. But back in 2019, everything changed. The whole approach got a major upgrade. We went from that simple checklist to a much smarter points-based system, where different clues have different weights. So, the new system has a mandatory entry ticket. You have to have a positive anti-nuclear antibody test, or ANA. It's the gatekeeper. If your ANA is negative, lupus is pretty much off the table. If it's positive, specifically at a level of 1 to 80 or higher, then okay, you're in the game and we can move to the next step. And once you're through that gate, you start racking up points. But not all clues are worth the same. A fever, that gets you 2 points. But having your joints involved? That's a big one. That's 6 points. Same for having specific antibodies in your blood. But look at the real heavy hitter. A kidney biopsy that shows serious lupus-related damage, that's worth a whopping 10 points all by itself. And that brings us to the magic number. After you've got that positive ANA test, you need to score a total of 10 or more points. Hit that number, and you are officially classified as having SLE. But, and this is so important, the experts who created this system put in a big disclaimer. They said these criteria are just guidelines. They are not a substitute for a doctor's own judgment. The final call always comes down to putting the numbers together with the patient's entire story. Okay, so once the puzzle is finally solved, the mission changes completely. Getting a diagnosis isn't the finish line. Nope, it's the start of the fight for control. And what's amazing about modern lupus care is where it starts. It's not with a prescription pad, it's with empowerment. Educating patients is number one. So is physical exercise to combat that awful fatigue. But one of the absolute biggest things is photoprotection. Sunscreen. For someone with lupus, sunscreen isn't just for a day at the beach. It's a daily, non-negotiable part of staying healthy. When it comes to medicine, you can think of it like a pyramid. The foundation, the base level for pretty much every single patient, is a drug called hydroxychloroquine. It's proven to cut down on flares and help people live longer. If there's a bad flare-up, doctors move up a level and add corticosteroids. For more serious ongoing disease, they bring in immunosuppressants. And then at the very top, for the toughest cases, you have the newer biologic drugs. So this mix of smarter diagnoses and better, more targeted treatments has really changed the game. It begs a question. What does the future really look like for someone diagnosed with lupus today? You see, the whole goal has shifted. It's not just about surviving anymore. It's about giving people a better quality of life every single day. It's about empowering them to live full, active lives. We've gone from trying to solve a cruel mystery to learning how to manage a chronic condition. But of course, the final goal is to solve the mystery for good. And with all the research happening now, you have to wonder, are we getting closer to not just managing lupus, but truly ending it? That's the next chapter in this story. Thanks for joining me on The Explainer.